call her Madam President, Cynthia Lee Shang. They're joining us this afternoon, so welcome. Of course, Dr. Jennifer Vegno, who serves as our health director of the New Orleans Health Department. Council member at large, Helena Moreno, who has been a strong partner as we have moved through in providing crisis management through this pandemic, and has had a lot to do with what's going on and will be going on here, right here, starting this week. We have our own Father Serrano, who is here representing the Hispanic apostolate. Myra Pineda, where is Myra? Myra needs no introduction because she just keeps going as it relates to the support that our Hispanic community and Latino community deserve every single day as she represents the Louisiana Hispanic Chamber of Commerce. And we also have Martin Gutierrez with our Catholic Charities, and I believe Mary is here as well. There you go, Mary. Thank you for being here. Also on that NOPL, you wear many hats for us. We had a good press conference earlier. But we are here, as you know, the city of New Orleans was hit very hard by this COVID-19 pandemic. But because of the response of our public, of our residents, trusting themselves, trusting data, science, demonstrating civic trust as well, we have been able to flatten that curve. We have over 6,800 positive cases and over 500 of our residents we've lost during this pandemic. But we're continuing to double down on our efforts and be intentional about meeting our residents where they are to ensure that they have access to adequate testing, also resources that are essential for quality care. We're standing together to help provide care and resources to all of our people, not only in Orleans, but being again intentional about a regional approach. No one at all should have to deal with living in silence or the silence or being worried about seeking information about treatment. We need all of our people to be able to trust, again, government leaders and access to quality care. And a part of that is with us, government and partners, doing the right thing to take that deeper dive, not only meeting our people where they are, but being, again, intentional in our approach and being honest about some of the barriers that our residents face, and even with fear. And our Latino community, Hispanic community alike, all of our communities of color, came into this pandemic at a deficit, and we know that. And because we know that, we even made sure before we even asked about doing mobile testing, but we did that on our own, again, because we knew we had to go in the community, bringing testing, and not just testing, but again, resources directly to our people who are most often underserved. These barriers that our communities of color face are tied to generational structures, whether it's racism, lack of access to quality care, very little access to wealth and opportunity, fear and anxiety, it's real. This has led, again, to issues such as high rates of underlying conditions in which we know have been the main causes and triggers that have caused our people to leave here. 500 deaths, 500 residents, 500 lives that we will not get back that are tremendous assets and have been to this community of the city of New Orleans. So with that, we are assembled here to bring you some good news, again, increasing the testing capacity as well as reaching our people and making sure that they have what they need to be healthy and to live safe and productive lives in this community as well as in our region. I am going to now ask our Director of the Health Department, Dr. Jennifer Vegno, who has been the lead as we've moved through this crisis. Dr. Vegno, come on forward. Thank you so much for your leadership.
Good afternoon. Thank you, Mayor. At the New Orleans Health Department, we are always committed to making sure every resident has access to the highest levels of care. That's why we started our mobile testing program last month, bringing testing to neighborhoods in New Orleans that might have been overlooked by other means. Although our original drive-through testing program with the federal government was quite successful, we knew that there were significant barriers for folks to be able to participate and take advantage, especially for our low-income and undocumented community members. At the mobile testing sites, anyone can receive a free test without barriers. As we started the mobile testing program, we were very careful to really examine the data of our patients that we had served there. And we compared data with our other healthcare partners, LCMC and Ochsner. It quickly became clear that our Latino community is seeing much higher rates of infection compared to others in the metro area. In fact, the positive case rate for Latinos that we've seen at these sites is more than 5 times that of non-Latinos in our region. This is a community-wide problem and a cause for great concern. So that's why we're here today, to emphasize to our Latino community members the resources that are available to keep you and your family safe. You can and you should get tested for COVID-19. It is free, it is safe, and it doesn't hurt. Your immigration status does not matter. You will not be required to provide an ID. At our mobile testing sites, you can access other resources your family might need, including food and financial assistance information, and Spanish-speaking staff members will be available to assist you. If you test positive, regardless of how you feel, you should isolate yourself from the rest of your family and those you live with. If you were in close contact with someone who tested positive, you should quarantine yourself for 14 days. This is to keep those around you safe. If you're not able to do that in your own home, there are other options for you, and you can talk to your healthcare provider about them or with our representatives on the phone. If you are severely ill, please go to a hospital to seek care. Like always, our hospitals will serve you no matter your immigration status. Hospitals are safe spaces. What's interesting about COVID is that many people who test positive do not have symptoms and do not feel sick. That means they may be infecting others without knowing, and others might be at very high risk of being hospitalized or dying. Wearing a mask, wearing a face covering, keeps your loved ones from getting sick and dying if you have COVID and you don't know it. In Orleans Parish, you are required to wear a mask in public. If you need a mask, we are providing them at our testing sites when you get tested. You can also go to sewdat.com, SEWDAT.com, or one of the free food pantries around town, as many of them are providing masks as well. Also, make sure you're doing the basics that prevent disease spread. Avoid close contact with anyone outside of your household. Wash your hands often, and clean and disinfect surfaces on a regular basis. The health department is here always to support our whole community, including and especially our Latino residents. We'd love for you to come visit us at one of our testing sites, or call 311 to connect to our call center with questions. Please share this information with your neighbors and friends. If you're a business owner, faith leader, or part of the media, please help get this information to your members, and together we will all get through it. Thank you.
Thank you, Dr. Vegno. And one of the things is that as we move into reopening our city, we are not slowing down testing at all. And as this city, we've been testing more, not only than the national average, but more than other countries. We're at 9% of our population that has been tested. And yet, that's not good enough for us because we care about our people. And we have a councilwoman, Helena Moreno, at large, I'm telling you, who has been leaning in and who has been relentless in making sure that we create a task force speaking to this immediate need in our Latino community. And it's a reason, she's one of the main reasons why we're here this afternoon, keeping testing going, meeting people where they are. Councilmember Helena Moreno.
Well, good afternoon. Mayor, thank you so much for allowing us to be here all together today. And I just want to say, you know, Mayor, when you and I work as a team, we just lean in, we go straight at it, and we go and address the problems that we see. And that's really what we're doing here today. So I thank you. And I also want to thank Parish President Cynthia Lee Shang. She's got representatives here. Because, I mean, at the end of the day, we have to show our commitment and support to adding resources to the Hispanic community as we deal with this COVID pandemic. I really think that what we're seeing here today, once again, highlights that minority populations are disproportionately being impacted by COVID-19. We saw just a few weeks ago the impact that COVID was having on the African American population, and now we're seeing the big impact that it's also having on the Hispanic population as well. When myself and Dr. Vegno started to see some of the data come in from some of the testing sites and the recent numbers that we're talking about today, we knew that we needed an increased outreach effort. So we did a couple of things first. First, we said, look, clearly we've got to deploy more testing aimed at helping those in the Hispanic community. And that's one of the reasons why we're having testing here at St. Anthony of Padua this week. We're also working with our partners over in Jefferson Parish to have testing in the Jefferson Parish area next week as well. And I'd like to thank Ochsner Health for allowing us to, for them helping us with the testing process and doing the testing here and also in Jefferson Parish. So, but in addition to increasing testing, we knew that we needed to do more. So with Dr. Vegno's support, we put together really an internal working group or task force to help identify potential reasons for increased cases, barriers to care and testing, and also what can we do to improve effective messaging. So this group, which is made up of some of the people that you see behind me, is made up of overall just great people who are faith-based business and nonprofit leaders, members of the city's health department, Homeland Security, and also Parish President Lee Shang's office, along with representatives from the Honduran and Mexican consulates and medical professionals, including Dr. Cantor with the Louisiana Department of Health. So during our first meeting, which actually just took place this week on Monday, we came up with several action items. The very first being that the Hispanic community must be aware of what we are seeing with this data, with the rise in cases. We must alert them that they have to take precautions. From there, we also identified the need for, of course, additional outreach. This includes providing more information in Spanish, more Spanish-speaking services, from having that available at our testing sites, which, by the way, will be available here at St. Anthony of Padua tomorrow, to also ensuring that contact tracers by the state are also providing services in Spanish. We're also putting together, with the help of our partners within the city over at NOSAP, Laura, thank you so much for all you're doing. We're starting to put together really a greater messaging campaign in Spanish aimed at several different types of PSAs that we're starting to put together at this point. And you know, we really are emphasizing about abiding with social distancing guidelines and, of course, mask wearing to slow down the spread of the virus. I'll mention, too, that I've been able to speak with Governor John Bell Edwards about this issue. He is very concerned. He has alerted his team and also has instructed them to start collecting increased data on positive cases based on ethnicity across the state so that we can have a better understanding of the impact across the state. Late last night, I also received a phone call from Courtney Phillips. She is the new Secretary of the Louisiana Department of Health. She called me, was very interested about the work that we're doing here in the city of New Orleans, or really Region 1, and invited me to join the Health Equity Task Force that the governor has, so that there can be increased Hispanic representation on the task force. But more importantly, what she would like to do is the work that we are doing here, she would like to work to amplify across the state of Louisiana, which is certainly good news. So let me just speak briefly about what we are hearing from the Hispanic community. Bottom line, there's a lot of fear about getting tested for COVID and receiving treatment due to what I believe are mostly rumors and misinformation. But as we know, once a rumor gets started, it just builds and builds and builds, unless you can knock it down with accurate information and just overpower the rumors and misinformation with good, accurate information. So I just want to say this. Here in the city of New Orleans, and I know that the mayor is going to support me in what I'm saying right here, we are here to care for the well-being of all people who live in this city. We feel that no one should think that they should have to suffer in the shadows. So we want to ensure that everyone feels welcome and has access to testing and treatment. Remember that they feel welcome to have access to testing and treatment. Before I wrap, we've got some Spanish-speaking media here. Obviously, they've got their viewers either watching on social media or they're going to broadcast later. Let me just briefly do a quick message in Spanish. Hola, buenos días. Soy Elena Moreno del Consejo Municipal de la Ciudad de Nueva Orleans. Estoy aquí para decir que estamos muy preocupados por el nivel de COVID-19 en la comunidad hispana. El nivel es muy alto. Nosotros en la ciudad de Nueva Orleans vamos a hacer mucho más para ayudar a los latinos que viven aquí. Mañana vamos a ofrecer pruebas gratis aquí en St. Anthony de Padua. No necesitas traer ID y es para todos edad 10 o más. Les digo que esta situación sí es muy seria. O sea que por favor usen sus cubiertas de tela para la cara y también practican distancia social. En la ciudad de Nueva Orleans, yo y el alcalde Cantrell les prometemos que estamos aquí para ayudar y vamos a hacer mucho más para ustedes, porque nadie tiene que tener miedo para venir para una prueba y nadie debería sufrir porque piensan que no hay ayuda para ellos. Muchas gracias. Thank you.
I know that you want to introduce
Absolutely.
some of our strong partners who are right here.
It would actually be my honor to do so. So let me introduce everybody who's going to be coming up, and then they'll speak accordingly. First, it's Father Sergio Hirano. He runs the Hispanic Apostolate in Kenner, but he's also very involved in many churches within the city of New Orleans, including this one right here, St. Anthony of Padua. Just an amazing advocate who is very much involved in the Hispanic community and knows the need that is out there. The next is our friend, mine and the mayor's, Myra Pineda. She is the CEO of the Louisiana Hispanic Chamber of Commerce. Just an amazing advocate over the years for not only the Hispanic community, but really has worked to promote Hispanic businesses as well. Mary Moran with Nuestra Voz, Our Voice. Now, Nuestra Voz, Our Voice, I first learned about them many years ago when they were working on issues with the Hispanic population within our public schools. But since then, they've just really embarked on a lot of greater issues, and Mary has just been a huge ally of mine and really helping with some issues that have been occurring recently that we need to work on to help the Hispanic community even more. And the final person is Martin Gutierrez. He is a COO of Catholic Charities and just does tremendous work throughout our city, and also is very much involved in the Hispanic community. And he's going to talk a little bit about the role of nonprofits who are really working in the Hispanic community, what they're hearing, and just additional support that they'd like to offer. So with that, I will start with Father Sergio Serrano.
Mayor Cantrell, honorable member of the council, the only Hispanic, Elena, thank you for the invitation to be in this board. I am happy to see the care that the New Orleans is taking for the Hispanic community at large. I have never seen an effort like this, bringing the Hispanic community to be present in this free test. And I want to speak to the children of those parents who don't speak English. You have to tell your parents that we are going to be here in my house. We need to start giving example at home. So this is my house. The Dominican house is opening the doors for today, Thursday and Friday, from 9 a.m. to 4 p.m. that you tell your parents, to grandparents, that they come to church, a safe place. We will have traffic police, but the police is not going to be interfering with any of the activities. They are going just to help us to get through with the activity. We will have Ochsner Hospital conducting all the testing. The testing is going to be fast. You come, you give your name, you give your address. You don't have to bring an ID. But we need to know where to send the results. The results are going to take between 24 to 36 hours to go back to you. So it's important you will trust us. I will be here. You know how we work with all of you. We keep your information private. We respect your own situation. You don't have to mention what kind of situation you are living at. You just need to come and help us to prevent. This is a prevention time. And how can we prevent? Keeping the distance, wearing our mask, using alcohol to clean our hands, and also is the way that we protect our family. We Hispanics, we always fight for our families. And if you don't wear a mask, you are injuring your own family, the ones that you say that you love the most. I have offered several masks to people, and they are telling me that they don't need them. Please, we all need to wear our mask, as you can tell. Please, be distant to each other. We Hispanics like to kiss, we like to hug, we like to be friendly. But this is the time that we need to change our way of life. Please keep the distance and help us to be safe. For the sake of those that don't speak English, if you may, I will go in Spanish. Soy el padre Sergio Serrano, director del apostolado hispano, y quiero que todos ustedes, los hispanos que nos están oyendo, agradezcan a nuestra alcaldesa y a nuestro honorable miembro del consejo este esfuerzo que están haciendo por nosotros los hispanos. Nunca había visto que la ciudad se interesara tanto por nosotros. Hemos venido a este país a sumar y a dar. Es el tiempo de recibir, por eso se ha abierto desde mi casa, porque hay que empezar a dar ejemplo desde la casa. Se ha abierto, nuestro párroco abre las puertas para que vengan mañana. Pueden venir los nietos de 10 años en adelante, los hijos, los abuelos, todos pueden venir, habrá estacionamiento, las pruebas son gratis, no deben traer ID, pero nos tienen que decir a dónde se les manda el examen, porque tomará de 24 a 36 horas tener los resultados. Después de tener los resultados, se les dará una información de qué cuidados deben tener. Se van a dar unos paquetes y se van a entregar unas máscaras. Muchos de ustedes me han llamado. Many of them have called me already and telling me they don't have masks. And I told them that we may have some at the parking lot that they can get out of the car and walk to the place with a mask. Vamos a tener algunas máscaras afuera. Si usted viene y se va a hacer el examen, le damos su máscara, la usa, viene al examen, en el momento del examen la retira, van a hacer una introducción de un copito por la nariz. Es un poquito incómodo porque a nadie nos gusta que nos toquen la nariz, pero es necesario en este momento. Y si tiene un poco de tiempo, los esperamos para el censo. Queremos que participen del censo. Si sabemos dónde están los hispanos, la ciudad, el gobierno puede traer más recursos para nuestra ayuda. Así que abrámonos una vez más. Yo estaré aquí todo el tiempo. Si alguno de ustedes tiene un problema, se dirige a mí. Si la policía les pide adicional información o algo, ustedes vienen a mí y yo hablaré con ellos. Pero lo que tenemos entendido es que la policía solo va a controlar el tráfico. Si la ven, son nuestros amigos. Están para protegernos, están para guiarnos. Gracias y los esperamos jueves y viernes, San Antonio de Padua, 4640 Canal Street, 9 de la mañana hasta que se acaben las asistencias, 300 pruebas. Thank you, Mayor Control. Thank you, Honorable Member of the Council.
Good afternoon, everyone. My name is Myra Pineda, President and CEO of the Hispanic Chamber of Commerce. Good afternoon, Madam Mayor, Councilmember Moreno, Dr. Vegno, members of the press, and special guests. On behalf of the Hispanic Chamber of Commerce of Louisiana, I would like to thank you for this opportunity to address our community. Our mission to foster a favorable business climate through education, advocacy, procurement opportunities, and networking is more important than ever as we recover from this crisis. We have been tirelessly working to inform and assist the needs generated by COVID-19 and to advocate for the unique issues that affect the Hispanic community, a vulnerable community that has been impacted disproportionately from a health and economic standpoint. COVID-19 has stressed long-standing disparities and inequalities, just like Mayor Cantrell and Councilmember Moreno explained. Inequalities that need to be addressed if we want to achieve true economic development and a thriving economy for our region. I'm excited to join the newly formed Hispanic Outreach Task Force and commend Councilmember Moreno for this initiative. There are obviously immediate issues to be tackled to prevent the spread of the virus in the Hispanic community and encourage more participation in the testing sites. I would like to thank the City of New Orleans, Jefferson Parish Administration, Ochsner Health System, and all frontline heroes making this effort possible. HCCL is committed to continue supporting your efforts and sharing this important message to follow guidelines, wear masks, practice social distancing, and just make sure that we are not spreading the virus and keeping everyone safe. Quisiera dirigirme a nuestra comunidad hispana en nuestro idioma. Los centros de prueba de la ciudad de Nueva Orleans y la parroquia de Jefferson han puesto a nuestra disposición oportunidades y los esperan. Se trata de erradicar este virus, de parar la propagación y de salvar vidas. Acérquense con confianza, ya que es gratis, no necesitan probar residencias ni presentar ningún documento de identificación. Como ven, tenemos a los líderes de la comunidad unidos, a nuestras autoridades de nuestra parte, así que se trata de ahora nosotros contribuir como comunidad. Finally, the COVID-19 recovery will take time, hard work, and cooperation, but our success will depend on continuing to work as a close-knit community focused on equity, diversity, and inclusion. Thank you very much.
Hello, everyone. I am Mary D. Moran with Our Voice Nuestra Voz. I first wanted to start off by saying thank you to the mayor and thank you to Council President Moreno for inviting us here today and for having us and having this discussion. I also wanted to thank community organizations that have been doing this work and that are not here but should definitely be recognized. Familias Unidas, Cristi Fajardo, El Pueblo Nola, El Centro, Isla, and Congreso. Thank you so much for your dedication to our community. Thank you so much for continuing to be in this fight together. I wanted to just talk a little bit about some of the barriers that our community is facing. Some of those barriers we've already talked about in terms of the fear. The fear is real when we're talking about having to show an ID and perhaps we don't have an ID, right? The fear is real when we are essential workers and we have to work. And it's hard to be in a safe environment and then to have to go home to your families and your kids and make sure that you're keeping them safe. Especially given that you may not be eligible for a stimulus package or any of these other relief efforts. The experience of our community is real when we're going without food, right? Or we have food insecurity issues, as well as we have landlords who perhaps may be using fear tactics to try to make sure that that they get what they need, even though we may or may not be working. So I just wanted to raise those issues because it's what we're hearing every single day when our organizers are talking to families on the phone, and it's a part of what the task force is trying to address. How do we make sure that landlords aren't coming after specifically Spanish-speaking families, right? How do we make sure that the testing sites like the one that we now have here remove the barriers? And that's so important, and at every step of the way, as we continue to communicate the concerns of our community, we know that that we have relationships here that will help us remove those barriers. In terms of resources, there is a need to have organizations and nonprofits in the area that are currently serving our communities to continue to keep in mind the barriers that exist. There are other forms of ID besides Louisiana ID, right? There are other ways to track people beyond a social security number, and so we want to just make sure that we are uplifting alternative ways, creative ways to serve all of our families. And we also wanted to uplift and make sure that as relief efforts continue in our community, that we do everything possible to remove those barriers so that we can get resources to communities as fast as possible. Because my experience in organizing, relationship is everything, right? We do things out of a relationship, or we make asks as we start to have those relationships. We want to invite elected officials to be in relationship with our community, to get to know us, to also get to know what our experiences are in the city. If you don't already have a organization that you're connected to, we'd love to invite you to be connected to our organizations and the other organizations that I mentioned today. And if you have more information, please reach out to me. Thank you.
Good afternoon. I'm here on behalf of Catholic Charities in the Archdiocese of New Orleans. We are grateful for this opportunity, so thank you. I'd like to highlight 2 or 3 points that Mary and Father Sergio mentioned. Yes, there are nonprofits out there who are providing services to the Hispanic and overall immigrant community. We've been doing it for many years, but we need more. We need others to step up to the plate and also, help out. Mary touched on something very quickly and very briefly, but I want to highlight what she said regarding immigrants having to go to work. A lot of the immigrants who we have in the city do not have access to government benefits. The stimulus package, food stamps, all of that is not available to them. So they don't have a choice but to go to work. And there's a huge, significant number of people who are getting infected with the virus, and they get infected at home. Why? Because relatives are going to work and coming back home with the virus. So I want to highlight what Father Sergio said about wearing this little thing. I know it sometimes could be bothersome, but it is important that we wear it. It's only one small thing that we can do that will have big, big, big impact. We don't have to do it for ourselves. We got to do it for the others. It's out of respect for the other, making sure that we take care of the other. Not so much ourselves, because I may have the virus right now and I don't even know it. And I may not even know it unless I get tested. But I can pass it along to somebody else. So, estoy aquí en nombre de Caridades Católicas y la Arquidiócesis de Nueva Orleans. Quiero mencionar 2 cositas que Mary y el Padre Sergio mencionaron. Uno es que sabemos muy bien que un buen porcentaje de nuestra población migratoria, de los inmigrantes que vivimos aquí en Nueva Orleans, no calificamos para la ayuda que el gobierno ha estado ofreciendo a raíz de esta crisis. Entonces no tenemos choice, no tenemos más que hacer que ir a trabajar. Y hay que tener mucho cuidado. Hay que tener mucho cuidado porque mucha gente que se ha estado infectando con el virus, han cogido el virus en sus casas. No es en la calle donde lo cogen. Sí, yo que voy al trabajo lo puedo traer a mi casa sin yo mismo darme cuenta. Y mi mamá o mi papá o mi abuela o mi abuelo es el que termina enfermándose. Aunque yo tenga el virus, tal vez yo no voy a demostrar ninguno de los síntomas, Así que es por el respeto y el cuidado a los demás que yo imagínense, que yo uso esto, y no tanto por mí, sino es por ellos. Así que hagamos caso a las guías, a las reglas que los expertos nos están recomendando que llevemos. Lavémonos las manos muy a menudo, usemos la mascarilla, la máscara y también guardemos la distancia. Muchas gracias.
Thank you all again. I know that you have heard from our collective voices that we are doing the right thing by meeting our people where they are. And today, this is a real focus on our Latino community. And it's well deserved. And so we will do everything that is necessary and keep up the testing capacity, again, as it relates to our Latino community, being intentional in every way. So with that, Ms. LaTanya, we'll take questions. Well, one of the reasons that we're wanting to, and we are increasing testing, is because we recognize that there is fear as well as a lack of access and barriers that have prevented our people from coming to get tested. So we are being, again, very intentional in our approach and in our actions to test more within our community. You're right when you say, when you look at the 500 in regards of lives that we've lost in the city of New Orleans, it has not impacted heavily our Latino community. However, it does not mean that it will not. So a part of these efforts, as always from day one, is to save lives. And we know that we can do that when we test aggressively and to be able to treat as well as isolate our people and provide them with the resources and tools that they need to be well. So you don't have to die, and we're saying that, and we're also seeing that in the care that our community is providing. And I'll ask Dr. Vegno to come and just elaborate a little bit more.
Yes, ma'am, thank you. One of the challenges, as I believe Councilmember Moreno alluded to, is the way that race and ethnicity are reported. Statewide, certainly our percentage of Hispanic population in New Orleans is largely higher than many regions in the state. And so statewide, when you see things reported, it's often black, white, and other. We need a better way to tease out whether someone is recorded as white who may be white and Hispanic, or identify as black and Hispanic. And so I think there's probably some undercounting just because of the way that we're reporting. But as the mayor said, you know, with the rates being high now, what we are worried about is that we will start to see hospitalizations. So there is a lag in time between when you might test positive and if you're going to have severe symptoms. And so now is the time to say, if you've tested positive, you need to isolate and protect yourself. If you start to have symptoms, get care early, and then hopefully we can avoid a spike in deaths in the Hispanic population.
Followed by Dr. Gutierrez. There's a lot of mention of testing, isolation, masks, all the way on. Is the new task force going to address maybe the issue of malnutrition or how to boost the immune system? Maybe do you consider that being important? Is there ways that affects somehow the vulnerability?
Right, yeah, so one of the things that we do at our mobile testing sites is we ask everybody who comes, we do a needs assessment. If it's a family, we say, are you getting diapers? Do you have formula for your baby? Are you having food insecurity? Do you have enough to eat? How are you getting food? You know, are you having issues with medications, et cetera? And we have resources on hand to be able to connect them better. So if they're a family and they are not signed up for WIC or Healthy Start, which is a benefit that they can access, we can get them, we can start that process right there. We have information about all of the food banks and food deliveries so that if they're not getting consistent food, we can then tell them how to get that. That's incredibly important because indeed what we don't want to see is this second wave of health-related concerns because people, their economic livelihoods have been devastated and they can't afford to eat and they can't afford their medications, so they're going to show up a few months later with really serious health problems that are not COVID.
This question is from Ms. Pineda. We already heard about how it's affecting those essential workers, which gives an aspect on how it's affecting the Hispanic business owners and those who have a lot of Spanish-speaking employees. Have they been able to benefit from some of the federal aid?
Well, as it's been mentioned, unfortunately, many of those small, micro Hispanic business owners don't have access to those federal funding and other loan and access to capital opportunities. And that's because of many reasons, not necessarily documentation, but maybe just poor credit or financial documentation not being in order, et cetera. So there is a very, very large impact to that sector of our economy. And the Hispanic Chamber is definitely very concerned and making efforts right now, putting into place programming, technical assistance, and other efforts to assist, to help in those areas, to build capacity and help those small businesses. Thank you.
Well, anyone who is sick should be staying home, and that whether they are an employee or not. And so no business owner or employer should be requiring an employee to show up from work knowing that they are sick, not just because of that employee, but for the care and concern of the whole. And so if that is what's going on, I want to know about it, like in real time, so we can address it swiftly. Yep.
Yes, at our mobile testing site, we will test everybody who comes in, including young children. We have already tested young children, and we've seen families all test positive, which is really important for that information. So yes, we're testing anyone.
Just on the worker piece, I would just add that, if there is someone that is being, forced to go to a workplace where precautions are not being taken, whether it's, won't allow somebody to wear a mask, whatever it could be, or even that business is in violation of the current city guidelines, I would encourage them to call 311 and report it. They can also report it anonymously so that we can go and see what's going on and see if we can rectify that situation.
Attitude? Thank you. The question is, there are many Hispanics who are too machos to wear a mask or to do their own will, and it's why this task force is taking place, to prevent and to tell everybody that no matter how strong you think you may be, you can carry the virus. It's why we have encouraged you to wear your mask, to keep social distance, to be careful how you wear the mask, that you dispose the mask or you clean the mask and not get the illness into your home. Many of us may have the illness as it was exposed by Dr. Vegno and others and not know it and bring it home. So if you wear your mask as a Hispanic that is transported in a car with 6 different people from different families, it doesn't matter how macho we are or you are, you have to prevent. You have to be aware that the infection can happen. Nosotros los hispanos somos muy machos, pero esto no se trata de ser muy machos o no, se trata de prevenir que la enfermedad pase a nuestros familiares, y el mensaje que han creado fuerza de trabajo es de prevención y de anuncio que la enfermedad está viva y contagia a cualquiera y no discrimina ni sexo, ni raza, ni si estamos fuertes o no. Así que los hispanos que les hemos insistido, por favor, les suplicamos, we beg you, please wear your mask. Les imploramos, por favor, pónganse las máscaras. Thank you.
Thank you all so much. Thank you. Thank you. Thank you so much. Oh, you too. And I'm glad you got your swing back. Do this. You make sure I get that. Okay? Make sure. Yeah, no,
And then you have the visa B2, and they're from Mexico, so the employer knows they're sick.